Hello, this is Dr. Joanne Manson, Professor of Medicine at Harvard Medical School and Brigham and Women's Hospital. I'd like to talk with you about and bring to your attention two recent papers that address the critically important role of sex and gender in health and disease, including the impact on disease incidence, clinical manifestations, and response to treatment. Now, one of the papers was published very recently in the journal Lancet, and the other paper was published earlier this year in JAMA Internal Medicine, was from our research group in the Connor Center at Brigham and Women's Hospital. Now, both papers review the growing evidence that biological sex and sociocultural factors that are encompassed by gender, including lifestyle factors, social determinants of health, and interactions with the healthcare system, are critically important in influencing health and also important to precision medicine. After all, precision medicine really begins with understanding the role of sex and gender in medicine. Now, these two papers discuss several domains, including genetic and chromosomal differences, epigenetic programming, and gene expression differences, hormones, sex steroid hormones, including exposure to hormones in utero and throughout the life course, and immune function differences. And it's well known that there are several differences between men and women in terms of the prevalence risk of various diseases. Very prominently, women are much more susceptible to autoimmune disorders such as lupus, rheumatoid arthritis. Men are more likely to have autism, attention deficit disorder. But even within certain diseases, there are really major differences that are due to sex and gender. And I'm going to focus on heart disease and COVID-19. Now, in terms of heart disease, we know that women are diagnosed at older ages. They're also more likely to have a delay in their diagnosis. They have a difference in symptom presentation. Although chest pain is very common in both sexes, women are more likely to have pain in the neck or jaw, also to have nausea or shortness of breath as a symptom. Women are less likely to receive evidence-based treatments in prevention, such as statins, less likely to receive reperfusion after MI, and they are more likely to have mortality, to die after MI. Also, women are more susceptible to heart failure with preserved ejection fraction, and men to heart failure with a reduced ejection fraction. Women are more likely to have microvascular dysfunction and reduced coronary reserve, whereas men are more likely to have obstructive coronary artery disease. And in the context of atrial fibrillation, women are more likely to have stroke and to die from stroke. Now, with COVID, it's been well recognized that men are more likely to have severe illness and to die from COVID. They're more likely to develop the acute respiratory distress and to require mechanical ventilation. It's been proposed that some of these differences may relate to effects of sex steroid hormones, that estrogen and progesterone may have some anti-inflammatory effect in tamping down inflammation. And this knowledge is actually being harnessed in some randomized clinical trials going on right now to look at whether estrogen or progesterone administration can reduce the severity of COVID illness. Now, also with vaccinations, there's some evidence that women have more robust response to immunizations, and it will be important to look at response to vaccinations related to COVID in the future, and whether there's any way to harness information about these sex differences to improve vaccination response in both sexes. So overall, these papers really highlight the critically important role of sex and gender in improving patient care and the practice of precision medicine, and also the potential of sex and gender knowledge and research in improving population health. Thank you so much for your attention. This is Joanne Manson.